Hello, my name is Don Tatalovich. I'm the owner here of Cornerstone Dental Center. And the question would be, why are our dental implants, what are those, and why are they the gold standard, or why are they really ideal for replacing missing teeth? So an implant, kind of as a basic idea, is a titanium post. We'll use that to replace tooth that's been missing, could be missing for a period of time, or something that we need to extract, but there's a space there that we want to put a new tooth into. With that space, there are some traditional options for replacing that tooth or masking that missing space, but a dental implant allows us to replace that tooth without involving any of the adjacent teeth. It also has other health benefits, such as helping to preserve bone. So traditionally, something that's discussed is a dental bridge. With a dental bridge, what was done was crown would have been placed on either side of the missing space on the adjacent teeth, and then a pontic or a fake tooth is attached in the middle of those crowns to create a bridge or spanning that space to replace a missing tooth. With an implant, we can replace that same missing tooth in that space without involving those adjacent teeth. When we start to consider replacing a tooth with an implant, the next question would be, what are the primary benefits, or what differentiates this from other traditional options for replacing the tooth? And so I think that those fall into a few different categories, first being the appearance or the aesthetics. And so a dental implant is going to most closely mimic a natural tooth, and so that gives us an opportunity to get a really good natural appearance and a good aesthetic outcome. For function, one of the things that we would consider with the dental implant, one of the big benefits, is that we're not going to be involving the adjacent teeth, and so we're able to place that titanium post and then put the crown or tooth on top of that post, allowing us to replace a missing tooth without involving the adjacent teeth like a traditional bridge might do. And then finally, the health benefits. One of the things that I think about with placing dental implants is that this helps to preserve the bone that's there, which supports both that tooth and that bone in that area will also be supporting the adjacent teeth. One of the major things that sets dental implants apart from other replacement options is not needing to involve adjacent teeth. And so going back to our discussion of a traditional bridge, the teeth on either side of that space will be involved in placing a bridge and closing that space with a bridge. Whereas in contrast, a dental implant will allow us to replace that tooth without involving those adjacent teeth. Another big difference that we see with dental implants is that implant will, through the functional chewing process, will stimulate that bone to stay healthy and will prevent resorption or loss of bone through disuse. So when we're considering dental implants, another question which we want to talk about would be, how successful would we expect implant placement to be? And so I guess the short answer is very successful. For dental implants, placing that implant in a healthy person who doesn't smoke, we would expect the success rate to be well over 90%. So we should expect a very successful outcome after we place our implant. So when I start to consider replacing a tooth or teeth in my mouth, what are some of the specific things that I should be considering? So as a patient, one of the things that I would want to start considering right away would be, what are my functional goals? And so in the past, removable prosthetics were used to replace teeth. One of the big limitations to those being removable is that they're going to offer less stability and then in turn less function. And so that's something that we really need to consider that when we're talking about removable versus a fixed solution like an implant. Another thing that I would recommend that people start to consider would be, are there other areas in your mouth where we're missing teeth, or is there throughout your mouth, are there other concerns with the health of the teeth? And so getting a feel for the overall health of your teeth and your gums and your bone. And then finally, what's going to be the long-term maintenance requirement for either the implant crown, or if one uses a bridge or a removable prosthetic to replace the teeth. Those are things that I would start to consider. So what's something that, as far as maybe an inaccurate view of implants or teeth or just dental restorations, some of the things that I've heard patients ask about or have some confusion on would be, I've had crowns placed and maybe I'm not aware that those could get cavities or I've had an implant placed in a location, so I wasn't aware that I needed to continue taking care of that. And so I would just encourage people that with the dental bridge or a dental crown or an implant, that's something that we need to continue caring for that the same way we would a natural tooth. So if you're considering dental implants, what would be your next step? And I think the short answer is please give our office a call. Having an opportunity to sit down with you and to talk about your goals, and then we can start to take x-rays and scans of your mouth so we can evaluate bone health and gum health and the health of the remaining teeth in your mouth. And that'll give us an opportunity to come up with a custom treatment plan for you.